So I think the most common symptoms that we see are what we call functional seizures. So individuals that actually present as if they're having epilepsy, but they are conscious throughout their fits. I mean, in the really severe cases, people can have 40 of these functional seizures every day. And they are essentially having a very, very strong, obviously, reaction to the emotions that they're feeling, whether that be anxiety, whether that be a stressful situation, or what we really understand is from trauma that they've experienced. One of the biggest challenges is that it sits between physical and mental health services. And certainly in our NHS, we don't have services that sometimes go across both. And it's a challenge. And so ultimately, what we need to be doing is looking at both an integrated service across physical and mental health services. At the moment, if a neurologist sees somebody who they think has got functional, they'll immediately call the mental health services and psychiatrists and say, come and diagnose, come and treat, come and assess, and then shift them. So unfortunately, these individuals have such a poor sort of experience of their diagnosis and their experience in NHS and in private, because people just don't know where it sits and how to manage it. So there are specialist teams.
For the longest time, it's been a diagnosis of exclusion. So generally, like neurologists will try and diagnose other conditions, and when you don't meet the criteria for those conditions, you'll then get a diagnosis of FND rather than it being a diagnosis of inclusion. And there are signs and there are sort of tests that can be done that will indicate whether or not you do have FND. And so there is a shift, and people are trying to shift more towards that kind of framework. But that means that people generally take a really long time to get a medical diagnosis, to get confirmation that that's what they have.
We've developed sort of a bit of a 5-step stage, certainly with the supervision that I provide to individuals working with clients that have FND, and certainly within the team that we work in as well. It's a team approach. It has to be a multidisciplinary team. It's an integrated working. People's egos are left at the door. We all support each other and we all take on the psychology goals, or we work with the physiotherapist, and we have regular meetings and what we call corridor conversations just to check in how things are going. And everybody is reading and working from the same plan for that client. But the first stage is education. And so it's really making sure that they do understand their diagnosis and they do understand what is happening for them. So we might do that with a bit of journaling. We've got some fantastic apps now, one of them called My FND app, where they will log their symptoms and they'll log maybe what's been going on for them around those symptoms. So education, explanation, that's one of the first key stages.
The second phase of treatment would be sort of formulation. So this is done as part of a team, and OT falls as an integral part of this, but it's really closely done with kind of psychologists and psychiatrists. Part of this is really starting to try and understand someone's values, their identity, who they are as a person, because that shapes how we treat and what we focus on in treatment. A big part of it can be risk assessment, so it depends on kind of what that person is presenting with and how they present. Also, if you're doing hospital-based treatment versus community-based treatment, and a really big part of that will be thinking about their mood disorders, if there's kind of risk of suicide, anything like that, and making sure that you've mitigated for any of those risks within your kind of initial phases of treatment.
And then the third part would be sort of really developing goals, making sure that people are on board with what they're there to do in their treatment, and really owning their goals as well. It's certainly an empowerment approach that we use. We keep the people very central to their treatment programs. So we will support them to understand sort of the grading process. So if they want to get back to work, there's a huge one, but obviously it's about how they look at, managing their sort of energy levels, about how they manage those symptoms, whether, and really tuning into triggers that kick off those symptoms, essentially. They really need to understand what it is that leads to that and really explore that. So we work heavily with psychologists, because they're really unpicking and understanding what maybe have caused these triggers and what it is in situations, or what are the things. It's a bit like PTSD in some ways. It's like, what are the things that actually set people off, who really, where do those feelings come from? Anxiety, fight, flight, So we work a lot on our goals, and that's stage 3.
Then we kind of move on to the nitty-gritty, which is actually treatment. We use treatment modalities like motivational interviewing, CBT sort of principles. It's very much kind of working within the space of team working collaboratively. That goal setting phase is so important, because if you haven't done that, you're going to be misaligned with what's important to that person. And it's lots of back and forth with other professionals around what we are doing.
So some of the strategies that we teach people are breathing. I mean, it's obvious, but not to many. If you think about the symptoms of when you feel anxious or nervous, I was feeling that on the train in this morning, they're actually, you tighten up, your stomach's churning, you are feeling sweaty palms, you're getting red in the face. So from a physical sense how that feels, and actually what you also experience is that classic fight-flight. So it's either get me out of here, or actually I'm going to get myself ready for this. So what we'll do all the time is sort of discuss about breathing techniques. Mindfulness is huge.
Grounding. Like quite literally, where you sort of focus on your environment, you focus your attention on the here and the now, in the moment, being present, using kind of sensory. So there's kind of your 5 senses, naming 5 things that you can see, 4 things you can hear, 3 things you can taste, etc., etc. And you're kind of bringing people back into the moment so that they don't run away with their thoughts.
And naming things in the room, that's what I do a lot with clients, is I sit there and I say, okay, look around you, tell me what you can see, say it out loud, explain what you're seeing, and actually what you're doing is distraction a lot of the time as well. So a key part of what we're doing in our work is sort of taking away from the sort of impairment, trying them, to stop them from focusing in, and just because it becomes bigger. It's like as soon as you say to somebody, don't yawn, people are then conscious of trying not to yawn. Or, I think one of the classic examples I got told by a neurologist, which was so good, was actually when you're driving and you've got to get into a parallel parking space, and you sort of go in, and if the music's going and you've got someone else in the car chatting with you and everything, no problem, zip, in you go. It's not a problem. As soon as you are there thinking about it and you turn the music off and you think, right, I've got to line this all up and everything, it will take 3 or 4 times. And it's because what you're doing is coming away from your automatic and how you do things just automatically without thinking about it, and you're making yourself think about it. And so as soon as you do that, you magnify everything. So that is what is happening with the symptoms. As soon as somebody is told, oh, come on, use your hand to reach out and grab that coffee cup, if they've got tightness in their muscles, or they've got what we call dystonia, where it's very tight and they can't release their hands, what we'll do is we'll get them doing something else. So I often have music playing in the kitchen activities that I'm doing, and I get them dancing and standing up against the surface and walking around and everything. And then you ask them, oh, can you reach over there and grab that for me? And they will be able to do it.
You can unlock the movement when you're not focusing on it. So it's just about kind of creating a space for them to be able to access that automatic movement.
So cognitive and behavioural therapy is an absolute key measure and an evidence base for this treatment with FND, because again, it's linking thoughts, feelings, behaviours. It's key. It's an absolute fundamental part of what we're doing, but what we're trying to do is give that to the client to really start building into and understanding day to day how they're thinking. Their thoughts, are they real? So it's just really unpicking all of those things. So psychology does that, but we'll go out with somebody into the community and suddenly the cars are rushing by, and of course it might be related to their accident that they had, road traffic accident, and so that immediately is going to cause anxiety. So we'll do a graded programme, we'll do exposure So we'll talk about, how do you feel at this point? What's your anxiety looking like? What symptoms can you feel in you? Right, we're now going to go and stand on the pavement. We're going to, ask you how you feel and do those questions again. So it's a very, very step-by-step process. And, it is slow. I think this is the thing. There is not a quick tablet. There is not a stay in hospital. And I think we're always confronted by people that just want that quick fix. Right, I'm coming in, paying the money, or, I'm coming in, I'm taking those tablets. Let's get the results that we want. And actually, there's a lot of hard work behind it because a lot of people aren't used to doing psychology. People don't like to do talk therapy. A lot of our clients are having to engage just to get them on board with actually understanding that they need to manage their mind and their thoughts to be able to cope with the feelings that they're having. So for some people it's very novel, it's very new.
It's building that toolkit. But that's what treatment is all about, is treatment's getting us to a point where you have a toolkit, you have lots of different strategies that you can use, and then depending on the situation you're in, you'll pull out the necessary or the appropriate tool, and you can utilise that.
One of the things we really understand with working with FND is there is an immense need for kindness and empathy with these individuals. As we've explained, they go through so much with actually getting a formal diagnosis, and then to actually understand what that means is very, very challenging. And so they will get a lot of, as we were explaining, going between services, in the mental health services, in the physical services, and people rejecting you, really. You're just feeling like, where am I going to get hope? Where am I going to actually have someone who understands what I'm going through and how are they going to help me? So I think, we're very aware that these clients are really sensitive and really need a lot of support. And we often, with relatives, have to do a lot of education and explanation because their understanding of it as well is really poor. And I think, we use resources all the time. There's some incredible websites out there. So Hope, FND.
FNDsymptoms.org is a really good one.
Amazing. And like we've mentioned before, my FND app. But also there is a fantastic book by Susanna O'Sullivan called It's All in Your Head. Yeah. And it's an absolute insight, and it's really useful because, again, she was an incredible neurologist, is a neurologist, and she has written extensively about cases, extraordinary cases, and it just helps to normalise it. And I think that's the most important thing for us all to do.
It's just also thinking about a lot of our clients end up feeling like their symptoms haven't been validated and they don't feel heard. And so they might come into a service that you might be working with them, and you might be one of the first people who offer them that validation, who offer them that empathy, and how powerful that is as just part of your treatment. Allowing them to feel heard is really important.